We're going to go live right now. Ontario Liberals are speaking to the media about the state of health care in Ontario. Let's listen in live.
But also in the injustices that they impose upon healthcare workers and our healthcare institutions. There have been many suggestions by many, including myself, that staffing agencies need legislation, and it's true. But I also think that a detailed, comprehensive analysis by the Auditor General will reveal that they need an overhaul. A value for money audit dedicated to temporary staffing agencies will reveal the full scope of the financial exploitation and catastrophe that Doug Ford is enabling. It will smoke out the bad actors and compel the government to finally take action so that we can restore predictability, fiscal responsibility, and accountability to our healthcare system and dignity for our patients and healthcare workers. With that, we're both happy to take your questions.
What did you make of what the health minister said yesterday, that the issues in the emergency rooms, it's not a money issue, is what she said, but then she also acknowledged that it's a staffing issue, and of course, you can't have staffing without money. Just like that.
As you pointed out, staffing is absolutely a financial issue. We see that hospitals are on the hook right now for hundreds of millions of dollars, if not billions of dollars, in retroactive payments. There's near universal deficits by hospitals in our province. And we see financial quarter after financial quarter, this government underspending by billions of dollars in healthcare. Money alone can't solve the problem, but at a time when this government is writing waivers for hospitals to be having deficits, they should instead be writing checks, because it is a very important start.
Well, that and the concerning part that many hospitals are accessing short-term, high-interest paying loans because they can't meet their cash flow obligations. So there is clearly an underinvestment in our hospitals. But we also see that there are surgical units that are closed because they can't attract the staffing that they need, the doctors and the nurses that they need. And private agencies, and as well as private medical clinics, will only continue to attract the best and the brightest away from our universal healthcare system. And that's a concern, and it should be a concern for everyone.
Just asked about the issue of the private clinics. The OMA and Dr. James, you talked about this before, that the idea of having clinics that are outside a hospital doing less complicated surgery isn't a bad one. Can you explain how, if you do that, you get around the problem of, well, wouldn't such clinics still suck staff out of the hospital where we need them? Would there be any difference? Does it matter if it's private or public?
It absolutely matters. Our position has been very clear from the beginning that if out-of-hospital surgical and diagnostic facilities are operated in a not-for-profit manner, linked to hospitals, connected to hospitals, with those protections against upselling and upcharging, then we can get the best benefits of doing elective procedures outside of hospital without holding our hospitals hostage. We have many examples of this right now. One is just down the street from here at the Holland Orthopedic and Arthritic Center. It's existed for decades. Not for profit, inextricably linked and connected to Sunnybrook Hospital. And I will point out that it predates Bill 60. These out-of-hospital facilities, not for profit, linked to our public hospitals, have existed for a long time, do not require Bill 60, and are a perfect example of how we can harness the best of these institutions without accepting the worst. Bill 60 only opens the floodgates for for-profit, private, investor-led out-of-hospital centers.
And private clinics, privately owned clinics, of course, are beholden to their shareholders. So, of course, there will be upcharging versus the clinics that are publicly funded and provide universal care for everyone.
Bonnie, on another subject, the government is...
We've been listening to Ontario Liberals speaking to the media at Queen's Park, addressing the state of healthcare in the province.